Doctor, nurse.
What's the old back people? The chiropractor. Yeah.
The veterinary one. Chiropodist, paediatrics.
Doctor, nurse, surgeon, midwife, DNA analyzer.
The admin staff, the people on the desks, the porters.
Police, ambulance, doctors.
Yeah, I don't know if maybe police, I don't think so. I just think like...
dentists.
Dentists?
Yeah, and orthodontists and stuff like that.
Doctor.
Nurse.
Physiotherapist.
Midwife.
The Health for Youth project started initially as a forum. It was an opportunity to work in partnership and collaboration with youth workers from around the area and to try and bring young people into the organisation to get a feel of what we were doing right and what perhaps we could do better. There was some funding available through HETV, and that helped us to fund the Health for Youth tours that we are currently running. The current format of the Health for Youth tours is looking at 3 specific young people's groups. So young people looking at careers in health, young people who perhaps aren't in education or employment, and young carers. The young people come in for their tour, usually accompanied by either their teacher or an adult. And then we take them on a tour of the hospital, which roughly takes about 4 hours. So to date we've done 9 tours, and each tour consists of between 8 and 10 students, and we take students all the way around from West Berkshire, our local area. We usually start off the tour by kind of going around and saying hello to each of you and asking you about what you're hoping to get out today, what your kind of career aspirations are, and if we can meet anybody on the way around to kind of help you with those. So if we start with you.
I'm here today also because I'm not too sure which route I want to take, and this will kind of like open or close doors, whether it's something I enjoy or not.
We usually start here on our executive floor, and we meet Jean O'Callaghan, our Chief Executive Officer.
You know, the hospital belongs to the community. We work for the community, and we want to make sure that we're doing what everyone needs. We also want lots of young people to find a career in health very exciting, and we want to attract you to come and work in healthcare, whether it's the Royal Berkshire or anywhere in the system. So
when we talk to the students at the start of the tours, we always talk about Holby City and the 2 different career paths that they have there, nursing and doctors. So as we go around and look at the back office staff, we try and pick out all the other different career paths that they have, from the sciences in terms of pathology, or accountants, or anybody else that we meet on the way. We kind of point them out. HETV's initial grant has helped immeasurably in terms of putting an administrator into post. It took us about 6 months and about 5 different rounds of interviews to find the right person who could interact with young people, but also be professional enough to manage to coordinate the tours for us.
Now we'll need to stay bare below the elbow in all clinical areas.
This is Emily. She's one of the sisters in A&E, and she's going to be showing us around today.
So as we go around, if you see any uniforms you don't recognise, shout, we'll grab them and we'll ask them what they do. Yeah?
Some of our nurses are dual trained, so that means they've got a nursing qualification for children and adults, so they will work in both areas as well, but our doctors all sort of mix in and out. Some of those patients will come into us not breathing, with their heart having stopped, being unconscious, and they need real sort of life-saving treatment straight away.
Who's had an x-ray? Anyone had an x-ray? So it's just like a posh photograph. Yeah? So if you're a radiographer, you might have to wear that all day.
Take the x-ray.
Right? Try it on?
Not really.
Not really? You feel how heavy that is? So you're going to have to work in that all day?
Is that actually heavy?
Yeah.
Oh.
Oh, she's got no strength. Anybody who wants to be a radiographer has got to have quite strong legs, because you're going to have to hold that all day, alright?
So do you all want careers in medicine or nursing or healthcare?
We've got a couple of nurses and a couple of don't knows. So open minds today. We're going to go into the short stay unit. And the guys, Minu, how you doing? Come through. Minu's one of our domestics. Say hello, Minu.
Hello, hello, hello.
So he's been working here for a long time. How many years you worked here?
Oh, 14 years.
14 years. He loves working here, don't you, Minu?
Yes. These chutes basically send blood samples all the way around the organisation through these chutes in this kind of pod, and that gets podded out all the way to pathology. So that's where we're going to go next.
Are they all that clever?
They are.
So making connections with our schools and colleges has been quite challenging. It's through our administrator Trudy, who's done a marvellous job in promoting the service, and actually now we're getting word of mouth, because now some students have come through, they're talking to their friends, and actually we're getting lots of people coming to us now.
So today's really opened my eyes to what myself as a placement coordinator and the NHS can do together.
So the drugs come into the department, they're delivered to the department, then the drugs get put on this conveyor belt here. The back of the robot there, where the light was on, it picks up the packets and identifies the drugs by the barcodes, so it knows what drugs have come into the department, and then it puts them away for us, it stores them for us.
Like how many deliveries a day, or like how much you get in one delivery? Or?
So the wholesale deliveries usually come twice a day, and we can, order as much as little and often as we want to.
The initial thoughts were always about making it a symbiotic kind of relationship, so that not only did the students get something from it in terms of seeing the hospital, but the hospital also got something from the students in terms of providing health promotion messages when they go, for example, to accident emergency, and also providing them opportunities to become members or volunteer within the organisation.
Tear open package and remove pads. Peel one pad from plastic liner.
Lovely, so do that.
Shock advised. Stand clear.
There you go.
Push flashing button. Shock delivered.
At the very end of the tour, what we like to do is just kind of have a quick debrief. We like to go through, I'd like you to think about two things. I think about what went well today and what you think could have been better.
The tours kind of like helped me consider like working medically or like with the NHS like a bit more. Like it's kind of opened my eyes.
I like seeing like the variety of wards and like different levels of like people in that ward.
Types. It's not just like nurses and doctors. There's so many different jobs that you can do. So that was quite interesting.
And also the children wards, because it's so colourful and bright, and
it really looked like comfortable for them. I also liked the resuscitation part because it's definitely interactive and more hands-on.
So that's the end of the tour. It's been really fantastic. It's been great to meet new students. We've answered all their questions. We managed to keep on time, which is always good. We got to all the places we wanted to, and it's been really good. So the project's going to be rolled out, and we're not just going to be taking students in who are currently in schools, but we're going to roll the project out also to young carers.
So they're a very hard to reach group. They often are quite isolated. So in fact what we'll do is customise the tours, probably smaller groups of people, make it slightly gentler, but again expose them to all the many careers that exist in the NHS.
Another group that we're going to reach is young people who are perhaps not in education or employment.
Then within the Trust we're working with those in charge of our porters, for example, to bring young people in, to spend time with them.
I would recommend having a good link between the colleges and the NHS employers, so that there are employment opportunities for young people and that they can see that these opportunities are available, and continually in the future young people know where they can go and where to get support.
This is fantastic because we've managed to bring the students here to have a look around and see the different careers, not just the nurses and doctors' careers, but they've seen a wide range of different things that they could maybe undertake. So it's a fantastic opportunity for our students.
And I'll make sure that everyone's got their eyes open, because there's nothing worse than being the person in the photo with your eyes shut, is there? Okay, perfect. Thank you very much indeed. Thank you.